Look at this picture. All these people you are seeing are already having kidney problem and are on dialysis. And the session of dialysis costs 50 to 70,000 naira per session. And the person is expected to carry it out 2 to 3 times in a week. Yes, you can see how costly it is. And this kidney problem you are hearing like a fairy tale is very common. Yes, it happens to both the old and the young, male and female, even rich and poor. It is no longer a poor man's sickness as you used to hear. Yes, but at the end of this video, I'm going to be showing you simple things you need to be doing so that you don't have anything to do with kidney problem. By now, you already know that the kidney helps to filter your blood and then remove waste and extra water and some other things that your body do not need and then push it out in form of urine. But the situation whereby the kidney is no longer functioning effectively, what will happen is that some of these wastes will start to pile up in your body. Some of these wastes that are supposed to go out in form of urine will pile up in the body, and you start seeing the person presenting symptoms like puffy face, the face will swell, then the ankle, what we call edema, the ankle will start to swell, then a lot of signs and symptoms like headache, vomiting, nausea, which I don't want to bother you with it. So, to keep your kidneys safe, these are the simple things you need to be doing. Number 1, drink sufficient water. Yeah, I think it's because of the importance of water. That is why God made it so common. No matter how broke you are, you cannot tell me that you cannot afford water. Yes. There are some of us that even drink water in the wrong way. They only wait until they become thirsty before they drink water. That's a wrong way of taking water. There are some people that if they are passing urine, if you see the color of their urine, it will be so deep yellow, like the color of blood. You are risking your kidney. So take sufficient water. From today, be taking sufficient water. Don't wait until you become thirsty before you take water. Then another one is a urinary tract infection. There are some of us that, commonize infection. They don't take infection serious. You see the person scratching the private part, quara, quara. My dear, you are risking your kidney. Anytime you notice infection in the body, you take it so urgent and treat it. There is a bacteria we call Escherichia coli. What it does is that if it gets to your private part and then enters to your bladder, it will, from the bladder and through the ureter, ascend to the kidney, causing inflammation. And then kidney problem has started. Then another one is some of you that used to do smokers. And then those of you that take excess alcohol. Even if you should take alcohol, it should be minimal. Because you notice that each time you take this alcohol, you'll be urinating. Every time you'll be passing urine. And that can lead to a dehydration, which is not good for your kidney. Then another one is some of you that used to take painkiller. Yes, small thing like this, they will rush and buy all these, any light pain, they will rush and buy all these painkillers, ibuprofen, paracetamol. It's not that you don't take it at all, but it should be under medical prescription. Yes, it's not every small thing you go and buy it. What these drugs do is that they reduce the amount of blood that flows to your kidney. And when the blood flow to your kidney is reduced, the amount of nutrient and oxygen reaching the kidney will also be reduced. Yes, and it's affecting your kidney. Then, this is the last and the most important one, which is high blood pressure. In fact, it's the commonest cause of kidney problem. So today, I want you to, if you didn't get anything from this video, go and check your blood pressure today. Don't say that you are still a young boy, a young girl. Yeah, it happens to even, I've seen it, a person of 15 years having high blood pressure. So you need to go and check your blood pressure today. Yes, it's as important as that. If you check it and it is high, the high blood pressure is not actually a death sentence. It's something telling you that there's something wrong with your body and there are things you need to do. Then before I end this video, before I forget, there's a good news here, which is, kidney failure, it can be reversed. Well, but it depends on the type and then the severity of the kidney problem. For instance, if it is acute kidney problem, maybe the kidney problem that just resulted suddenly, it just occurred suddenly. Maybe the person did not take adequate water, or is because of the infection, or maybe the person lost blood. Once these things are being corrected, for instance, if it is because of dehydration and that is lack of water, and the person is given adequate fluid, the kidney can revive and start working effectively. Then if it is because of infection and the infection is being handled and treated, the kidney can revive and start working effectively. If it is because of intake of all this pain relieving and the person is being stopped from taking it, the kidney can revive and start working effectively. Then, but for chronic kidney disease, that is the one caused by mainly uncontrolled long-term high blood pressure or uncontrolled long-term diabetes, it can be managed and then controlled, and the person can start living a normal, healthy and sweet life. So my dear, enjoy. Just like I said earlier, in my next video I'll be talking about high blood pressure. You know, it is very common and we need to address it. So my mother has been having high blood pressure for the past 30 years and she is still very okay and strong. So I'll be giving out simple tips on what you need to do to put your blood pressure in order. So I know you like this video. Click on the like button there, subscribe, click on the notification bell so that when I drop the next video, you'll be able to access it. Also, you have loved ones. Information, a single information can save a life. So you can send to them too.